Hi, this is Katie Hurley for Everyday Health, and I'm here to talk to you about suicide awareness. The CDC recently released a report showing an increase in suicide rates in every state, including a 30% increase in nearly half of our states. Suicide is currently the 10th leading cause of death in America. An interesting statistic from this report showed that 54% of people who completed suicide had no known history of mental illness. So it's really important that we talk more openly about mental health and that we understand the risk factors and red flags for suicide. One of the biggest known risk factors is a previous suicide attempt. Beyond that, there are other factors to look for, such as substance abuse, a diagnosis of depression, bipolar disorder, anxiety disorders, addiction disorders, eating disorders, or schizophrenia. These are all associated with a potential suicide risk. Financial instability, losing a home, the loss of a job, relationship problems are all risk factors for adults. For children and tweens and teens, bullying and cyberbullying and social insecurity are risk factors. Social isolation is a risk factor at all ages right now, and it is on the rise. It's really important to know the red flags that a friend or loved one might be at imminent risk. If your friend or loved one is communicating a specific plan and appears to be trying to access lethal means, if he or she is giving away prized possessions, or talking about a will or future planning on his or her behalf, those are red flags that your friend or loved one might be at imminent risk and needs immediate help. All red flags should be taken seriously. Other red flags include agitated or anxious behavior, talking about death, and when people talk about death, they don't necessarily come out and say, I feel like I want to die today. What they say is, you might be better off without me, or you won't miss me when I'm gone, or I won't be such a burden to you when I'm gone. So these statements can be very subtle. Your friend or loved one also might communicate feeling trapped or experiencing unbearable pain. You might notice increased rage or anger, and you might notice increased mood swings. So what should you do if you think your friend is at risk? Well, if you believe your friend or loved one is in imminent risk, the best thing you can do is follow a safety protocol. Keep the person safe. Remove all lethal means from the home. Call 911 or get to the nearest emergency room. To help your friend as they work through treatment, you can talk openly about mental health. You can listen without judgment. You can drive your friend to appointments. You can help your friend or loved one mobilize resources and get the psychiatric help they need and a licensed mental health practitioner for psychotherapy.